You can take off your shirt, please. Thank you. Okay. Can you face the camera a little more? All right. So, go ahead and take a deep breath for me. Okay. Deep breath. Okay. Deep breath. Okay. Deep breath. Okay. Just gonna squeeze it in here a little bit. Okay. Deep breath. Okay. Deep breath.
Yeah.
Okay. I'm gonna come right under here.
Last week there's a mannequin over. I think we're
okay.
Oh,
deep breath.
I got compartments in
Okay. I'm gonna listen to your apical.
Hello.
Because he's stressed. I had to spend an hour doing therapeutic communication. Because he's very stressed.
Okay. Your apical is normal. The uniformity of your chest is uniform. No use of accessory muscles when breathing. I'm going to go ahead and take a listen to your backside. Whoops, have you turn around. Okay. And every time I place it, please take a deep breath. Okay. Mary.
Hi, Mary. Hi. I'm tired. I've been so tired for some reason.
We went to Red Lobster and had endless shrimp. I'm like super tired. We ate too much.
Yeah. I'm not looking forward to my week. Clinicals and simulation.
You guys have a lot going on.
Wait, what is it? Oh, icy hot. I have a random thing of icy hot in my.
Okay. So anterior and posterior lungs sound good. Your heart sounds good. Now I'm just going to go ahead and take a listen to underneath your sides, your arms. So we'll listen to this side first.
Sterile glove. Everything else should already be here.
I was talking about the week.
Oh.
Maybe we would be after.
I can move on. I've seen it and I've got
Okay. I'm going to go ahead and listen to your right side. So if you could angle yourself a little bit. Okay. 3 fingers. Okay, go ahead and take a deep breath. Okay. Fingers.
Okay, so I'm gonna get this peer checkup done at the next.
Okay.
Can you take off your shirt for me? And from here, I'm just checking out the skin. The skin is pink, warm, dry, and intact. No lesions anywhere. She is not using any accessory muscles, no retraction as she's breathing, no dyspnea noted as well. And what I'm going to do is I'm going to get you to take a deep breath in and out. Deep breath in, deep breath out. All right, so basically that shows a symmetrical chest expansion. And what I'm gonna do is get you, if you can, to, you wanna sit in this little rolly chair for me? Just so it's easier for them to see. All right, so there we go. Just adjust, there we go, perfect, right there. All right, so at this time I'm also gonna palpate the eight different areas on the posterior chest. And what I want you to do is say 99 for me, okay?
Okay. 99, 99,
99, 99, 99.
All right, Texas firmness without any vibration, so no consolidation. Note it. I'm also going to go ahead and palpate the areas as well, okay? All right, percussion of the posterior wall balance, all no dullness, which is usually a sign of consolidation. Also, do you feel any pain when I do this?
No.
All right, so no CVA tenderness, no signs of kidney infection. At this point, I'm going to listen with the diaphragm of my stethoscope to the 8 fields. And what I want you to do, Myra, is say E for me.
E, 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 E.
All right, so basically all I heard was E. I heard no muffle sounds through my stethoscope, which shows no consolidation, which is a normal finding as well. Normally you would hear like kind of an A, which usually signifies that it's some kind of consolidation in the lung fields. Now, right now, I just want you to take a few deep breaths and continue to do so until I tell you to stop, okay? All right, nice deep breath. Good. Nice deep breath. 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 And nice deep breath. All right, so lung sounds are clear in all 8 areas. There's no adventitious lung sounds. There's no wheezing, no rhonchi, no rales. It is a normal finding for the posterior back. And I am right now also going to palpate your spine. Any tenderness or pain when I do this?
No.
Okay, the spine is in its correct alignment. So now we're going to move around to the anterior portion of the chest, okay? You can have a seat back on the bed. Okay. We'll trade up. All right, so on the anterior portion of the chest, skin again is warm, dry, intact, no breakdown anywhere, no lesions noted. And I'm gonna listen to 4 different areas of your chest, okay? One thing I need you to do right now is just take some deep breaths when I tell you to, okay?
Okay.
Okay, deep breath. Deep breath. Deep breath. Deep breath. All right, so lung sounds are clear in all 4 areas of auscultation. No adventitious lung sounds, no rales, no rhonchi, no wheezing.
Take a listen to your lungs. I'm going to listen on the front and the back. And every time you feel my stethoscope on your skin, I'm going to have you take a deep breath for me. And usually I would do this directly on your skin, but under these circumstances, I'm going to listen through your clothes, okay? Okay, have you turn around for me. Same thing, take a deep breath every time you feel. to assess lung sounds. Okay? So please take off your shirt. Okay. And then the first thing I'm going to ask you to do is breathe in and out. I'm going to listen to your bronchial sounds. Okay? Breathe in and out. Okay? Okay. So here I heard bronchial sounds, here I heard bronchovesicular, and at the periphery, vesicular sounds. And looking at and noticing your respiratory rate, it was within a normal range. You don't look like you're using any accessory muscles, no bulging, without difficulty.
No.
Okay. You don't have difficulty breathing, right?
No.
No, okay. And then I'm going to listen to 2 sites on the left side and then 3 on the right. Okay, lift your arm for me. Breathe in. Okay. In. Okay. And then I'm also going to listen to the back. Deep breaths. Last 2. Okay. And then all the lung fields that I auscultated were nice and clear. There was no crackles or wheezes, okay?